headaches and blurry vision.
So tell me about the swelling.
Well, it just started in my feet, but then it kind of developed more towards my hands and my face. I can show you a picture from before.
Yeah, that's a little concerning. Also, the blurry vision doesn't sound great. So let me take a blood test and a urine sample and check your blood pressure, and we'll see what we can find.
Okay, cool.
So I have your test results back. After looking at the numbers, it's looking as though you have high blood pressure, excessive proteins in your urine, and an unnatural enzyme balance in that sample we took.
So what exactly does that mean?
All of that points towards preeclampsia, which is a condition found in pregnant women.
So is there anything we can do about it?
Unfortunately, the only real treatment is to induce labor.
So how did this happen?
Well, let me explain. Basically, it all stems from the fact that your placenta is malfunctioning. Normally, blood vessels form in the 4th month of pregnancy and connect to the placenta to provide your baby with the nourishment it needs. In your case, your placenta is producing inflammatory proteins, which are bad for your circulatory system. This can happen for a variety of reasons, like having an insufficient amount of blood flow to your uterus, having any damage to your blood vessels, a problem with your immune system, or it could be a kind of genetic disposition. However, risk of getting preeclampsia are higher for women in their first pregnancies, women 35 or older, and those with a history of high blood pressure, diabetes, or obesity.
I may be 37 and on my first pregnancy, but I think I'm pretty far from obese.
Yes, you are, which is a good sign.
You mentioned something about inflammatory proteins. What are those?
Well, first, it starts with the blood vessels between you and your uterus. Because the placenta is malfunctioning, these vessels aren't forming correctly. Normally, they have a nice dilated opening that allows the maximum amount of blood flow from you to your baby. But for preeclampsia, this opening is narrower and the walls are more fibrous. In more severe cases, this can hinder fetal development.
So what does that have to do with proteins? Do I need to eat more eggs?
Not that kind of protein, Kyle. When this opening is fibrous, your vessels release inflammatory proteins similar to ones that repair vessels if you're bleeding. However, these proteins don't operate effectively, and they easily can get into the rest of your body's circulation.
So what does that do to me?
Mainly 2 things. The first is that the body's natural response to inflammatory proteins is to constrict your blood vessels since their cells, called endothelial cells, are being damaged. The second is that endothelial damage also makes your kidneys retain salt. Both of these events cause hypertension or the high blood pressure we're seeing right now.
How do we know my blood pressure is high enough for this diagnosis? What's a good blood pressure?
Blood pressure is normally 120/80. The top number is the pressure of blood coming out of your heart when it pumps, and the bottom is for when your heart is filled back up with blood. Your blood pressure was 146/94. Anything above 140/90 is worth looking into, and if it were more than 160/110, we would be in a much more serious situation. Severe hypertension due to preeclampsia can cause hemorrhagic strokes or even placental detachment from the uterine wall.
So far you've only talked about how preeclampsia is causing my high blood pressure. Didn't you also say something about my liver?
So no, not just your liver. Vessel spasms or vasospasms can also be a cause of preeclampsia, and depending on where these blood vessels are in the body, it can affect certain bodily functions.
So let me guess, blood's not reaching my liver correctly?
Right. It can also explain the blurry vision you've been having. Vasospasms in the upper parts of your body might be affecting your retinal blood flow, and that protein-rich urine, that's most likely a direct result of vasospasms causing irregular blood flow to your kidneys. Your kidneys are slightly malfunctioning so that you're excreting needed proteins that would normally be in your blood.
That doesn't sound good.
It's not too serious, but it's something we need to keep tabs on. The thing is, that endothelial damage that I was talking about causes your blood vessels to be more permeable or let fluid go in and out of them into the tissue. When you don't have as much protein, you have more fluid invading your tissue and causing swelling.
Well, how do we solve these problems?
Because the root of the problem is these vessel connections between the placenta, the biggest solution, like I said before, is to induce labor.
I'm only 5 months pregnant. Do we have to induce labor now? Is that even possible?
So you're not far along enough in your pregnancy to induce labor, and your preeclampsia isn't severe enough yet to warrant those kinds of measures. I do want you to start coming in more frequently for your prenatal checkups just so that we can keep an eye out on your symptoms. There is a chance that your preeclampsia can turn into eclampsia, which is a much more severe condition, and it involves having seizures. And if it does reach this point, I'm going to give you anticonvulsant pills just to stop those seizures from occurring.
Is there anything that I can tell my friends that are pregnant to look out for in the future?
Just tell them to keep up with their prenatal appointments and make sure their doctors are checking their urine, their blood, keeping up with their swelling, and making sure that their blood pressure is at a good level.
Is there anything they can do to prevent it?
So a healthy and balanced diet is always recommended. Obviously no alcohol, and ensure all medications are confirmed by your friend's doctors. Make sure they're elevating their feet to address the swelling issue, but make sure you don't stay stationary for too long. Have your friends keep a log of their blood pressure if they want. That could help throughout pregnancy, just to make sure that everything's okay with their blood pressure, and making sure that they're sitting each time they do take their blood pressure. And then also they can test their urine on their own, so they can buy reagent strips if they want to do it at home, and a potential cause for concern would be a score above a 1+. And if it's a 2+, definitely tell them to call their doctor right away.
Dr. Paris, and I'll see you at our next appointment.
Absolutely, and feel free to call if you have any questions whatsoever. I know this is scary, but we can tackle it together.
To summarize preeclampsia, the root cause is still being widely studied, but mainly it has to do with a malfunctioning placenta that fails to develop new blood vessels between women and their uterus. Some common symptoms normal to pregnancy are nausea and vomiting and excess swelling. Other side effects could be high blood pressure, excess protein in urine, severe headaches, changes in vision, either a blurry vision or loss of vision, upper abdominal pain, shortness of breath. Treatment options include induced labor, medication to lower blood pressure such as antihypertensive pills safe for pregnant women, corticosteroids to improve liver and platelet function to prolong pregnancy and maximize fetus development, anticonvulsant pills to prevent seizures in extreme cases of a preeclampsia. Preventative measures include healthy and nutrient-forward diet, a frequent weigh-in, checking blood pressure, and testing urine. Thanks for watching the video, and we hope you learned something about preeclampsia.